we should not opt for FUE only technique for higher grade of baldness. Why? This is an example. He had undergone hair transplant few years back. What was the technique used for your hair transplant?
They have used the DHI technique and they have implanted 1800 grafts there.
1800 grafts implanted by DHI technique at some other center, and you can see the final outcome, which is very unaesthetic. A small area was covered, lot of area is still empty. And if you see the donor area, can you see the donor area? Donor area is almost ruined and there is nothing left on the back side. So very difficult case now to cover and to operate, but still we try to do something with a strip technique or combination of beard. How satisfactory the previous results? How was that?
That was not totally satisfactory because the hair was growing, but these results were not so totally satisfactory because when the hair was growing, it looked so awkward because the other part of the area, like vertex area and the crown area, it was not really looking so good. So a lot of my friends are saying, sir, this looks so odd. Either you have to keep it completely bald. So even after doing the transplant, so then also I have to keep myself bald, the FUE.